Hi, my name is Dr. Robert Bagoff.
And I'm Dr. Stephen Levenbrook. We want to thank you for tuning in today. We're here to discuss today the single tooth anesthesia system and how we use it in our office.
The system has been commonplace in our office for quite some time. I was one of the original users of this prior to coming to marketplace about 20 years ago. I've been a promoter of this product for many reasons with Milestone Scientific. One of them is that this changes the nature of how we deliver anesthetic in our office. Dr. Levenbrook joined me in practice a number of years ago, and it was extremely easy for him to learn how to use this. It took him about a minute. And after that, he has been using this ever since. We have no other anesthetic system in our office, and the goal is to make sure that our patients get not only the best care, but the best delivery of anesthesia, which is one of the biggest problems we find to overcome in patient comfort.
And as Dr. Bagoff mentioned, when I joined him in practice here, the learning curve was maybe a minute, if that. So very intuitive, very easy to use. It's totally replaced every other traditional syringe found in the dental office. And in fact, our newest associate, Dr. Nachman, has just given his first injection with the device. And he can't believe what he was missing in dental school. So we have the system in every operatory, and you'll soon learn why. The system changes the way anesthetic is delivered, has so many benefits for both the clinician as well as the patient. And we're going to get into that in the presentation. So let's dive in.
Our goal in everyday practice is to make our patients comfortable giving some type of anesthetic. We've had patients come from other offices, and they're terrified. They're constantly terrified of the needle. When I was a kid, I grew up in Brooklyn, New York, and the dentist that gave me an injection used needles, and in those days, they were reusable. And I asked him when you could stop using the needle. He said when it got too dull to push through the skin. Today, we're going to focus on a paradigm shift, how we go from dental school to residency to clinical practice, overcoming the issue of pain in giving an injection, or even the psychological concept of pain in giving the injection is an issue that will plague dentistry until we move forward to the 21st century, as we have with so many other tools in our practice.
So as we see here, we can use conventional anesthetic carbules in the single tooth anesthesia system. Everything you've all seen, everything you're all used to since dental school. And that's exactly what you have in your offices today. And that's what we have. But with the STA system, we can administer any regional or local anesthetic that you presently employ for your patients in your office, from inferior alveolar blocks, V2 blocks, to local infiltrations, PDL injections in the form of a single tooth injection. The STA system is upgrading that delivery system to administer anesthetic. You can use any of the carbules of your choice in a predictable, in a safe way, a comfortable fashion for both provider and patient. The system has eliminated, as we had said, the plunger type of syringe from our office, and instead has shifted to this pencil grip controlled by a rheostat, a foot pedal that we're also used to. There's a controlled flow rate from the system for patient comfort. There's pleasant audible feedback during the injections, so the clinician knows exactly how much anesthetic has been delivered and can focus truly on the injection site the entire time that they're giving the anesthesia. There's a safe holster stand that the clinician can use, which reduces mishandling and ensures a safe recapping process following the injection. It's a reduction in patient anxiety as they don't see the traditional type of syringe in front of them coming at them in their injection, and so much more. We can't wait to show you the sleek design of the unit too as we get along.
So historically, we see that there is literature to show that needles were reused way back when. In pharmacies, needles were used, in doctors' offices, and we've come into the 21st century with the STA single tooth anesthesia system. we have to look as we entertain other products in our office, CAT scans, intraoral cameras, digital radiography. Needles have not changed since the 1800s. And we have to change the concept, not only in our minds, but on our patients' minds. Painful injections and needle phobia has been something we've tried to overcome since I've been practicing for over 37 years. In dental school, every one of our faculty members told us that they give the best, most painless anesthetic injection in the world. How do we change that concept in our patients' minds who are on the other end of our needle? First of all, the device was always a big silver syringe waved in front of the patient's face as best as we tried to hide it. The single tooth anesthesia system is easier to keep in the palm of your hand. The patient doesn't have an idea that this is exactly what's going to happen. And we no longer have patients watching the plunger slowly injecting into their mouth. They're focused on other things. They can see our hand. We also have a better visualization of where we are injecting into an anatomic landmark. It makes it much easier for us. And as an aside, as we get older, some of us have a little arthritis in our fingers. It is more difficult to give an injection with a conventional syringe than the single tooth anesthesia system. Okay.
So as mentioned earlier, we know that local anesthetic injections are the hallmark of dental phobias. We can address this overpowering concern with the STA system and change the perception of which and how anesthesia is delivered. We'd be finally catching up with a lot of the other technologies that I think a lot of you employ in your office. And this system can truly do that. It replaces the dental syringe. In fact, we don't have any traditional syringes, like we said, and that's been for years. So that's because the STA system has become our standard of care in which how we deliver anesthesia, from palatal and buccal infiltrations to inferior blocks, mental blocks, V2, as you can see on the list on the slide in front of you. We can successfully deliver profound anesthesia in a predictable manner in a very exacting location. So we have greater control over the injection site with this pencil type grip. We're very stable when giving an injection. We can find very little meandering in the soft tissue when administering the anesthesia, and we can deliver the anesthetic accurately and exactly where we need it. Our patients appreciate that, and that we can anesthetize a single tooth, and they can be on with their day, because we find that when we exactly give that anesthesia right where we need it, there's no collateral numbness or prolonged anesthesia from their visit, and they can get on with whatever they need to for the rest of their day when their visit's over. I want to bring your attention to the slide here in front of you. These are some real-time clinical photos of myself and Dr. Bagoff delivering anesthesia to our patients in our office using the STA system. You'll notice the ease of administration highlighted by the pencil grip for the doctor. And I think, as Dr. Bagoff mentioned, it's much less strain for any clinicians who may be suffering with some arthritis from working over the years in their wrists. There's easy visualization, as you can see from the clinical photos, and it's comfortable for the patient. If we bring our attention to the upper left, we can administer a mandibular block, as we've talked about, with ease. And as we work our way across the top row, you'll notice buccal infiltrations being administered exactly where we need it at the apical area of that tooth that we're working on. We can even give the ever so dreaded palatal injection using the STA system without much discomfort for the patient. The device doesn't vibrate. It doesn't have any unpleasant sounds. As I mentioned earlier, the only sounds you'll really hear is just letting the clinician know how much anesthetic has been delivered from the carpule. But it can be done in a methodical, repeatable way that's easily taught to any colleague. And again, as you bring your attention to the photos, you'll notice the wheel of anesthetic that's being administered exactly where we intended, exactly where we need it. And the patients really appreciate that.
So one more thing about these slides. The first person that Dr. Levenbrook ever injected was me. The way that I was brought into the trial for the STA system was I was injected by another dentist. there was a level of expectation that I had based on the understanding of how I was going to be comfortable. And it met that level of understanding. After showing Dr. Levenberg how to use the system, he delivered an infiltration and an inferior alveolar block on me. And at that moment, I knew that not only was I able to do this, but it was easily teachable to my colleague, and his hand skills are outstanding to start out with. But truly, it was a comfortable anesthetic. And in our office, we call this computerized anesthesia, which is exactly what it is. There is a computer that is helping us deliver the anesthetic in a more methodical way that can be either rapid or slow based on what the practitioner is feeling is necessary at the time of delivery.
I think a lot of the discomfort comes from that pressure of a volume that's being administered in a small space, but using that computerized distribution of flow rate, the patient, it really turns to a patient experience that's unparalleled by using the STA system. So here's a video on the STA setup and its use. And so we're going to play this now, but I want you to notice a couple of the things that we talked about. You'll notice the foot pedal that's involved in the flow rate. You'll notice the holster and the safety involved with the device. And I'm going to let the video speak for itself.
The STA Single-Tooth Anesthesia System is a computerized anesthesia delivery system that can do all dental injections utilizing a standard dental anesthetic carpule. The STA Single-Tooth Anesthesia System features the wand handpiece that comes in a variety of needle lengths and gauges depending on the injection technique being performed. Turn the power on to the instrument. Attach the foot pedal to the connector indicator under the front panel. Slide the anesthetic carpule, metal collar first, into the cartridge holder and press firmly so the carpule is penetrated by the harpoon. Once anesthetic is in place, you will connect the cartridge holder to the top of the STA Single-Tooth Anesthesia System and turn to the left. Once engaged, the STA Single-Tooth Anesthesia System will automatically purge the tubing and push air through the tubing before beginning injection. The vertical scale at the top left side will illuminate, and all bars should be lit, indicating the carpule inserted is full. The remaining 4 bars each indicate 1/4 of the carpule. As each quarter is delivered, the light bar will go out and a corresponding tone will sound. Secure the wand STA handpiece into the needle cap holder on either side of the instrument. Confirm proper settings determined by the injection technique. STA mode has a single anesthetic flow rate. Normal mode has 2 anesthetic flow rates, controlled flow rate and rapid. Turbo mode has 3 anesthetic flow rates, controlled flow rate, rapid, and turbo flow rate. Depress foot pedal to activate flow of anesthesia. Begin the injection by depressing foot pedal lightly to activate the control flow rate. Once injection has been completed, return the wand handpiece into the needle cap holder using one hand.
As you see in the picture here, a posterior superior alveolar injection can be given with ease. Also, going back to the video for a moment, this is easily put together by your dental assistant, hygienist, or yourself. The unit is easily cleansable with every device that you're using to wipe down the operatory presently. It is computerized and it sits on your countertop or on a mobile stand. It's very easy to use. And as you see here again, we can go right into the incisive canal just like you would with any other anesthetic. I find that is easier to visualize the area of injection than with a conventional syringe.
On this slide here, as we've talked about, we can see a palatal injection being given. The STA system easily maneuvers to give an incisive canal injection, as we just saw, buccal infiltrations, palatal injections. anything of which we may need to successfully perform that procedure. Again, an anterior middle superior alveolar injection, a single site injection that can numb multiple maxillary teeth, both through central incisors, through mesial roots of the first molar. The sky is the limit. Really, any injection that we find we need to administer in our office, we can successfully do with this STA system. As we had talked about, it's single use tubing and needle, and I think the patients appreciate that today more than ever. It's very hygienic, safe, and easy to use.
We can also achieve anesthesia through palatal or labial injection, and much more focused, as Dr. Levenbrook said. Another thing to go back, the packing that the tubing comes in is open in front of the patient, so they see that everything is individualized for them, specifically for that procedure. As we go around the arch, there is not one injection that I have found over the years that I cannot give with this system. It is versatile. It is easier in my hands and Dr. Levenbrook's hands. We are accurate. In fact, I find that I, in many cases, give less anesthesia than I would with a conventional syringe to get maximal effect and make the patient comfortable for that short period of time we're doing the procedure, or elongate the time based on giving more anesthetic if we're doing extractions. And in our practice, we do extractions, graft, fatty tissue regenerations, sinus lifting, implant placement, composite restorations, crown and bridge, everything you would find in a conventional, everyday family practice.
Again, just other slides here showing indications that we can use this STA system for an anterior middle superior alveolar, as we saw. Again, any injection that we need to provide our patients with profound anesthesia, we can do that in a safe, easy manner without prolonged effects or collateral numbness. I can't tell you enough how many times we've had new patients come in or patient reviews, and a lot of the focus on those reviews have come from the comfortable anesthesia or that paradigm shift where a lot of the fear or phobias that the general public has revolves around the actual numbing procedure before any dentistry is even done. As we've always heard, a first impression is one of the most important impressions. And I think that we can truly achieve this with utilizing the STA system. It's something that we hear day in and day out from our patients, from new patients or referrals. And I think it truly sets our office apart.
Again, for aesthetic dentistry, periodontics, implant dentistry, the STA is the top of our list of things that have changed the nature of our practice and delivery of comfortable, restorative, and surgical dentistry.
So again, it's a win-win-win for both dentist and patient. And we want to take this opportunity to thank you for spending the time with us today, learning about the STA system and hoping that you can implement a lot of these benefits that we find from the system in your office, in your practice, sooner than later.
As many patients you see now are coming out of COVID, and they're looking to do dentistry that they haven't had in the past 2 or 3 years. We find that people are very, very interested in computerized anesthesia, how we can deliver the comfortable anesthesia to them as they need more dentistry than ever before. The other thing that we brought up, both Dr. Levenbrook and myself and our new associate, Dr. Gottman, have discussed that dental schools have had limited exposure of patients to dental students, even including residency programs. So the administration of anesthetic, while we were in dental school, those of my age, was volumetrically more, and today volumetrically less. So we have an opportunity to teach the younger generation the use of a device that will change the nature of their practice, make it easier for them to make it more comfortable for their patients. We'd love to hear any questions you have about the system, and most importantly, the areas of patient management that we have seen this associated with has been amazing. It has changed the nature of our practice, and we can't talk enough about how good the device is, and how we use it every day, and think about how we can upgrade our practice every day, delivering the most comfortable, pain-free anesthesia and dentistry. And isn't that all of our goals? Thank you very much for taking your time sharing with us.
We appreciate it.
So the first question is the anesthesia preheated in this device? The answer is no. We have found after over 1,000 administrations of anesthesia plus that if you put it in your hand and the room is warm, this should be fine. There's really no need. And I know there are many devices on the market that preheat the anesthesia carpule. We don't find that this makes a big change in the ability to create a comfortable environment for the delivery of the solution.
Yeah, thank you for the question. I agree. I think the device itself is really, where we're going to get a lot of that patient comfort. So I haven't found it necessary clinically. I think Dr. Bagoff hasn't either. But the answer, no, it doesn't preheat with the device.
Okay. The next question is, what's the price point for this? I would recommend contacting your local dealer, and they will be able to discuss that with you based on who you're using and what sales they have at that time. Some of the other questions that we've gotten over the years are, how easy is this for the assistant, for a hygienist to use? It is one of the most amazingly easy devices. In fact, because the carpule preloads almost itself, and there's, as opposed to the conventional syringe where you have to engage the plunger, this is a lot easier to activate. It's, I find, a lot safer because the syringe is placed into a location on the device to hold it in place. It doesn't roll around the table, can't fall on the floor, and it also makes it easy for the doctor to use it again.
That's a good point. Yeah, the glass carpule is protected at all times. So easy to put in, engage the harpoon, and very easy to take out in a safe manner.
We've been teaching this to our residents and people in our implant program at NYU College of Dentistry. The learning curve is about 30 seconds, maybe 45. But overall, it is easier to visualize the anatomic structures to anesthetize, much more comfortable for the dentist to use, as we've said before, and the patient.
Thank you for this next question. Yeah, we find the effect of the STA anesthesia is exactly the same effect of anesthesia in the block region. So we can give very effective mandibular blocks with the device.
Okay. Realize most people are using a 27 gauge needle with a conventional syringe. Here we're using a 30 gauge needle, so it's a little more comfortable. It is, again, easy to get to the exact right position and deliver the solution. One of the biggest problems we see as teachers in delivering anesthesia for our students is they don't understand that you have to get under the periosteum to deliver the solution. The goal is to numb the tooth and have the anesthetic perforate and absorb through the bone. In this case, this device makes it easier for the student to understand how to use it and visualize that they're getting to exactly the right location.
I think the tactile sensation from using this device is truly enhanced compared to the traditional syringe. So that's a great point. Hitting your landmarks, finding your landmarks, getting under the periosteum, contacting bone, just as we've all been taught during our injections, you're going to get a great feedback and tactile sensation when using this.
One of the advantages that has been added to the WAN system, the single tooth anesthesia system over the years, is that the base is a little wider, it's much more stable. You can hear the sound of the unit and actually adjust it for a little louder, a little softer. Internally, the unit is exquisitely stable, very, very thick plastic material. And we find that each small upgrade adds so much more value to the unit overall.
Our next question here, the volume of anesthesia liquid that ends up in the tubing from the machine to the administration. I'm assuming that I'm referring to after the injection is administered, how much is left over. I find very little. So that full carpule is nearly injected.
Okay, if you're using a 1.8 cc carpule, about 0.2 cc's, about 0.2, which is usually what will be left in an anesthetic carpule. It is insignificant in the ability to deliver a block or any infiltration. And again, we've done extensive surgical procedures, restorative procedures, and periodontal procedures. We find that the amount of anesthesia that is left in the tubing is insignificant.
Just wait a few moments.
Yeah.
If there's any other questions?
There are also a number of ways to keep this device in the office. One is on a bracket table. One is on the counter behind us, and that's the way we deliver. Another is on a stand that you can move from room to room. In certain states, in the United States, hygienists are allowed to administer local anesthesia. So there are courses that they can take. This is a device that is easily moved into their operatory, whether they are allowed to do it or they keep it on the bracket table, and the doctor comes in to administer the anesthesia. Our patients are used to this. They're literally psyched that we have it. And we also display this on our website. We want people to know that we administer computerized anesthesia. It's part of our technological prowess in dentistry. And we have to move ahead because patients' expectations are that dentistry has become as comfortable as you could possibly imagine. We have to deliver that every day.
It's a great point. I think so. We keep it on the countertop, very small footprint, but again, whatever whatever's easiest in your office, whether you'd like that to be mobile and move from operatory to operatory, or keep it in one operatory for yourself. But easily cleansable, wipe it down, and you're good to go for the next patient. So it's a really great device that I think will set your office apart.
And from a management standpoint, it has also become a referral source. We treat a number of patients who are fearful or have contemplation about getting certain types of anesthesia in any dental setting. This device has given our patients reason to refer other patients to us. Just so you know, there are other devices on the market, and we have tried just about every one. In order to sit here and give you a fair evaluation of this device in relation to others, we usually take another device and use it for about 3 months. And we discuss this with our patients, and our patients know that we teach at NYU College of Dentistry and Newark Beth Israel Medical Center, General Practice Residency Program. So we're always trying to better what we do in their best interest. We have never found a device on the market that has the ability to work well in our hands and deliver the anesthesia in a comfortable way for both sides, the patient and us. Easily cleansable. Our staff uses it, sets it up for us very simply, and it is a reliable. I think that's a very important thing. It is reliable. Over 1,000 anesthesia deliveries. It is a reliable device, and we have one in every one of our operatories. I hope we have answered all of your questions, and thank you very much for joining us today. We want to thank the Dental Tribune and Milestone Scientific again for the time and effort that they put forth in helping us deliver this information to you. And again, if you have any questions, please contact Milestone Scientific. I'm sure their contact information will be up at the end of this presentation. And if they're questions directed for Dr. Levenbrook or myself, we'd be happy to get back to you via email. Thank you again so much. Stay safe and have a wonderful day.
Thank you, everyone, for taking the time out of your busy day. Appreciate it.